So I am live on Facebook too. All right, guys. So I've pinned that question at the top here, guys, just to kind of give you guys an idea of what's going on. Hey, everyone on Facebook, 𝘿𝙧 Performance Plus Physical Therapy. This is Q&A with Dr. D. I am going to be answering any questions that you guys may have, but I'm also going to pose a question to you guys, a lot of questions that I get from patients. I'm going to go through what my answer is and the reasoning behind that answer. So if you have questions too, please feel free to hop on and share that information with me. Today, we're going to be talking about ankle sprains, and I'm going to go back and forth because I'm on Facebook and IG at the same time, guys. Okay, so hope everyone is doing well. It is Tuesday. I had to reorient myself to what day it was because there's just so much going on. But today is Tuesday. I hope the week is going well and everyone is kind of settling into what the week looks like, what's going on. But let's get right to it, okay? So today we're talking about ankle sprains, and I'll post to you guys a question that a patient of mine had. Now, to give you a bit of background, this was a young patient. She was a runner, and while she was running one day, she sprained her ankle, rolled over the side of her ankle. Okay, hey Dana, how you doing? So rolled over the side of her ankle. And when she rolled over her ankle, she had a lot of pain at the point in time. She got some swelling and decided to rest. Didn't do anything for it, but just decided to rest. And basically, what happened is 2 weeks later, she was still having pain. So at that point, she reached out to me and messaged me and said, hey, this is going on. What do I do? Do I need to come in? Is this something serious? What am I supposed to do if I'm still having pain while I'm walking? Okay, so to give you guys a little bit of an overview with an ankle sprain is when you roll to the outside of your ankle. There are quite a couple of ligaments on the outside of your ankle that stabilizes your ankle. And when those ligaments are stretched out, when you roll over your ankle, that's what we call an ankle sprain. Okay, when you get an ankle sprain, there are a couple of things that are going to happen. Your body's going to respond to that injury. So you're going to have swelling within the joint. You're going to have some inflammation. A lot of people have a lot of acute pain with it. And usually you have a change in your range of motion in terms of how much you can flex and how much you can point your ankle. Hey, Niasha. So those things also happen. A lot of people have also a lot of change in terms of their proprioception, or your ability to tell where your foot is in space, whether it's up or whether it's down, without actually visually looking at your foot. So you would find with a lot of people, once they have an ankle sprain, they have a higher tendency to get sprains over and over again because their ability to kind of tell where they are in space changes. Okay, so she had been going on for 2 weeks now after this ankle sprain, and she was still having pain. What's the next best for this patient? So there are a couple of things, and bear in mind, she didn't do anything at all. So there are a couple of things that you can do when you have an ankle sprain. When you've just rolled over your ankle, you're going to see those changes. You're going to get some swelling. You're going to get some pain. You're going to be hesitant to put some weight on it. First things first, if you are having pain in your ankle so much that you cannot put your full weight on it, chances are you may need to get an x-ray, okay? And the reason for that from a medical stance is to make sure that you don't have some sort of fracture that's going on. That's a standard of care for ankle sprains, okay? So if you have a lot of swelling in your ankle, you're not able to bear any weight on it, you're having pain like you've never experienced before, this is a really good time for you to get an x-ray to make sure to rule out that you do not have a fracture. So that's number one. Let's say that was not the case with you. Hey guys, thanks for joining me. All right, so let's say that that was not the case for you, and you had a situation where you rolled over your ankle, you were able to put some weight on it, and you're walking around. It wasn't hugely swollen, but it still hurts after 2 weeks. What's your next step? There are a couple of things that you can do. The first thing that you want to do is do a lot of early range of motion. This is very important. Range of motion meaning how much you can flex and how much you can point your ankle. This is really important to make sure that once you get that injury, you're going to get a lot of swelling in that joint, and it's essential for you to keep your range of motion. Fluid does take up space, physical space within the joint, so it's going to change how flexible you are. So your ability to squat, to walk normally, to even go up and down stairs is going to be changed. So you want to really work on getting that flexibility back into your ankle. There are a couple of stretches that you can do that will assist you with that. Stretches to the back of the calf, stretches to the soleus, which is the deeper calf muscle, and also stretches sometimes to the bottom of your foot will assist you with this. So start working on really flexing and pointing and trying to get your ankle moving. You can do what we call ankle alphabets, where you kind of draw out the alphabet with your ankle, so you're moving your ankle in all directions. These are very basic exercises that can help you once you sprained your ankle. You also want to focus and work on making sure that you're elevating and icing that ankle, and that's going to help to get all the inflammation out of that ankle. Okay, so you want to make sure, again, once you have all of that inflammation going on, that's going to start changing how much you can move in terms of flexing and bending your ankle, and that can also affect your pain. If your ankle is really stiff and it's not able to push through the swelling that's in there, that causes pain, and that facilitates that entire cycle going on and on and on. So it's something that you really want to pay attention to. Okay. So those are two things that you can really work on. If those things do not work, if those elementary things do not work, that's when you want to start getting some help from a professional source. So you can reach out to your physical therapist, you can reach out to your orthopedic doctor. Someone with an orthopedic background is the best person to go to get some assistance and to get some advice from. Chances are they need to take a look at you. Once you have been having pain for more than 2 weeks, chances are you're now starting to get into the range where we consider that injury to be either of more of a subacute, or it's getting into the chronic stage in terms of longer duration. But also chances are you've done more than a mild sprain. You have something that's a little bit more serious. It involves a lot more tears of the ligaments on the outside of the ankle, and can even start indicating some sort of damage within the joint and stuff like that. So you want to get it looked at by a professional that's going to give you the best advice and figure out exactly what's going on. You may need some imaging in terms of an X-ray or MRI, and that will really help you figure out exactly what's wrong and then exactly what you need to do. So long story short, the question is, I've had an ankle sprain for 2 weeks. I'm still having pain. What's the next best step? And the summary of that is, hey, Karen, hey, Mandy. And the summary of that is you want to do early range of motion, moving your ankle up and down right away, trying to get that motion back. You want to make sure that you're icing that ankle. And then that if those two things do not help you, then you definitely want to get in to see an orthopedist or see an orthopedic physical therapist, that they can help you, assess you, and give you all of the information that you need. Okay, that's going to tell you what's the next best thing to do. All right. So that's my little talk about ankle sprains. Anybody have any questions? Now is your time. And I'm going to be doing a series of these, guys. So if you have a question that comes up as you're thinking we've already logged on, just kind of message me, shoot me a quick message, or log on to the next time when I'm on. Ask me that question. I'm happy to answer your questions for you. So I'm just going to check the feed. Oh, it worked for you? Good, Karen. I'm so happy it worked for you. It's very important. Early range of motion, strengthening, it's very, very important. So I'm just going to check the feed if we have any questions. And if not, I'll wish you guys a great night. And I will see you guys next time. Again, if you have any questions that come up that you want to ask and you want to have a free Q&A, we have nothing but time now. So Q&As, and if you have any quick questions, let me know and I'm happy to answer your questions for you. Alrighty, I don't see anything on Facebook. I'm gonna check IG here. Going through this. Pardon my lack of technological skills, guys. Waving to everyone. Alrighty, I think we're good, guys. So if we don't have any other questions, hit me up with your questions, guys. I'm going to try and do this daily or every other day. It really depends on how busy my schedule is. I'm going to try and do this every day so you guys can really kind of get in here and ask your questions. I hope this was helpful for you, and let me know what your questions are, and have a great night, everyone. All right, bye.